Let's turn now to efforts to roll out the vaccine on a global scale, should we? And joining us is Anil Soni, here, Chief Exec of the World Health Organization Foundation. Hello to you. Thank you so much for joining us on the programme this morning. What more does the developed world need to do to help those less fortunate?
Well, thank you, Kate, for having me. The developed world needs to follow through on its pledges to donate doses and to ensure that the governments of low-income countries have support, doses, funding, technical support to roll out vaccines. Currently, less than 5% of the population of low-income countries has been vaccinated. Vaccine inequity is morally unjust. It's also epidemiologically and economically self-defeating. So it's in all of our interest to ensure that everyone is vaccinated.
Isn't that what COVAX is for?
Exactly. COVAX is delivering vaccines around the world. In fact, COVAX has contracts for 3.7 billion vaccines. Only 500 million have been delivered. Wealthy countries have promised to donate 1.4 billion doses, but less than 200 million have been delivered. We want to create the ability for everyone to use their voice and their wallet to contribute. People-powered vaccines can be an important motivator to elected representatives. The WHO Foundation created the campaign Go Give One, gogiveone.org, where you can give 4 quid and buy a vaccine for someone else and show that you are willing to do what you want your government to do, which is to follow through on its commitments to donate vaccines through COVAX.
So I put this to the government minister this morning. I don't know if you heard him or not, but he was basically saying there was a big fire, as we know, in India earlier on in the year. And as a result, there aren't enough vaccines to go around at the moment.
I don't believe that's true. There are more than 800 million excess doses in high-income countries across the G7, including the UK. That is a lot of doses that can be distributed. Are there enough doses to vaccinate everyone in the world? Not necessarily, but there are enough doses to vaccinate just as many people in low-income countries as in high-income countries. We have the vaccines now. What we need to do is follow through on our promise to deliver them and make sure that people have access.
How disappointed are you with the British government?
I am proud, as someone who spent 20 years working on HIV/AIDS, that in such a short period of time in this pandemic, we've developed vaccines and delivered them to more than 3.5 billion people. I am incredibly disappointed in everyone, any government and any leader who has facilitated the inequity such that people who are in high-income countries, including myself and my family, have access. We are privileged, we are protected. I am grateful for that. The fact that my family and relatives in other parts of the world don't have access, that's a tragedy, and we should all be held accountable for that.
Including the British government?
Indeed, any government that can do more, that isn't.
Okay. 1 in 2 people in high-income countries, I believe, have been vaccinated. When you talk about low-income countries, it falls to 1 in 13 people. What impact is that vaccine inequality actually having in real terms?
It breeds variance. It also causes massive economic damage. It's in our interest, our self-interest, to ensure that everyone is vaccinated. The world is a petri dish. When you have a population that's well vaccinated, but another population that's not, it's in that population of people that is not well vaccinated that you have variants. That's where they emerge. And variants risk reducing the efficacy of the existing vaccine. And also it has massive economic damage. Trillions of dollars is what it's going to cost high-income countries, the UK, Europe, the United States, because low-income countries don't have high vaccine coverage rates.
The World Health Organization had set a target of 70% of the world, the globe, to be vaccinated by the middle of next year. Is that still within reach?
If we act, we're certainly not on track today. The interim target was to reach 40% of the world by the end of 2021. It's December 2nd. That's days, weeks away. We have to do much more quickly in order to keep that 70% target alive and real.
Okay. It's good to talk to you. Thank you very much indeed for taking the time. Much appreciated.
Thank you, Kay.